YNSA is YNSA scalp acupuncture. New scalp acupuncture is invented by Toshika Yamamoto, who is a famous physician of Japan. He invented points on head for acupuncture and for neurological disease and all type of body pain management and diseases. This acupuncture is based on point locations, and all locations are according to diagnose. There are 9 type of scalp acupuncture, but most famous scalp acupuncture is Toshika Yamamoto scalp acupuncture, because it is based on diagnose. In this scalp acupuncture, we have points, we have not areas, and every point is situated on a particular position. In front side, this is front side. You see, this is yin side, and this is back side is yang side. Okay, then the yin and yang is going from this center line according to this. This is yin, this is yang. Then there is one mid sagittal line. It's visible to all. Dr. Anita, it is visible?
It's visible, sir.
Yeah. This is center line of body. And it goes throughout up. It is visible?
It's visible.
Now I make dotted. It is visible?
Oh. Okay, the dots are not visible, sir. But we can see the doll. The dots are not visible.
Okay, then I put the dotted line with particularly. Now this line is visible to all?
Prof, not too clear.
It's not clear.
Zoom is not clear?
It's
At
not
all.
clear. Not too clear.
Now? Now it is visible?
It's better.
Okay.
Not too visible,
Then,
but it's better.
It's a little visible. It's not clearer.
it is blurred?
No, 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 no.
Then?
I think it's slightly divisible.
Now it is more visible?
Prof,
Manageable.
the doll is visible. The line is not too visible.
The line is not visible. If you can use the darker pen.
1 minute.
Prof,
I think red
is the reflection of the light, the light in your background, is the reflection of the light, sir?
I think you should use a darker pen.
Now it is visible?
The line is still very faint, so I think maybe we should use the darker pen.
Okay, if I use darker pen, then I have to use red one. This is visible?
Better.
1 minute. Because if I use more darker pen, it is more problem for me. Now it is visible?
Yes, sir.
Yeah.
sir. Yes. Yes, prof.
Okay. This line is mid-sagittal line. Okay. This is mid-sagittal line. Then in this system, the brain, the body is, the head is, the scalp is divided in 4 different zones: left side, right side, then yin and yang. This is a line of yin and yang. This is yin side. It is visible or not?
It's visible, sir.
It's okay, sir.
Okay. So this area is divided in this. There are 9 basic points. Their points are started from A, B, C, D, E, F, G, H, I. Okay. And for sensory points, ear, nose, eyes, and mouth. Then 3 brain points: cerebrum, cerebellum, and basal ganglia. Then first of all, we find the A point. The A point location is 1 centimeter on both sides. 1 centimeter on both sides. You see, I put it from 2 centimeter. Then the first centimeter on that side is 1 centimeter, and this is 1 centimeter. This is 2 centimeter line of A is 2 centimeter line parallel to mid sagittal line, and it is 1 centimeter below the hairline and 1 centimeter above the hairline, like this. Okay, it is visible.
Yes.
Yes, sir.
Okay, this is A point. Point A on both sides, like this. Okay, then what is the indications of A point? You know the indication of A point. It is C1 to C. This is C1 and this is C8. All the problems of cervical region, then head problems and head area problems, migraine, epilepsy, headache, then cerebral palsy, then all the nerves, those are in C1 to C8. All the functions of those nerves, it is used for all type of cervical pain, upper body, in upper limb area, in hands, upper arm pain and all. This is A point. Now, how we needle this A point? If you have problem in, first of all, with probe you find like this, a point most painful area like this for palpating. Then on upper side, where is painful point, put needle on that point. If you have a problem above the C3, then you put needle start from hairline. In this picture you see hairline or not? Hairline is visible to all?
No, sir.
This is I make 1 minute. This is hairline. If you are want to treat C3 area and C1 area and C2 area, then you put needle start from hairline to top. And when you put needle from bottom 1 centimeter below the hairline, then it treat C8 nerve, then C7, C5, 6 and 4. So you have to put needle like this. It is clear to all?
Yes, Prof.
You see both two needles?
Yes, Prof.
Okay. Then you remember all the indications of a point or not? Cervical vertebrae pain, pain in eyes, teeth, ears, swelling throat, cranial nerve problems. Then there is another point, B. Then B is another 1 centimeter from hairline. On both sides, and we go from center line like this on hairline. So I go for 1 centimeter from here. It is a dotted point on hairline like this on both sides. This is for shoulder. If you have any shoulder pain problem, then you use the point B plus A. Sore throat problem with the thyroid gland, connect with point A to C. Okay. Natural hairline. Then the problem in shoulder blade, sore throat, problem with the thyroid gland, connect with point A, B and C. Now it is clear to you. It is point B. It is visible B or not?
The B written is not visible, but the point is visible, sir.
Okay, writing is not visible.
Yes, sir.
Hello, Prof.
Yes.
Please, sir, can you repeat the function of B point, sir?
B point, then
Yes.
upper shoulder and shoulder blade pain, sore throat, problems with thyroid gland, connect with point A to C. All the problems with connected to A to C. Now it is visible. You see the right B.
Yes, Prof.
Prof,
Okay.
please, how many centimeter from the hairline?
On hairline, 2 centimeter from mid sagittal line. I show you. Like this. This is 2 centimeter. Because if I put from here, then it is 2 centimeter from mid sagittal line. This is 2 centimeter. You see or not?
It's clear, sir.
Correct,
Yes. 1 minute. Now it is more visible. 1 minute. Now it is clear.
Yes, sir.
Okay.
Prof, I have another question, sir.
Yes.
Okay, my second question is this. You know, point A, you
Yes.
said for the headline, below 1 centimeter and above 1 centimeter, make up the
Yes.
A line. So is it
Yes.
applicable like that to B point?
B point is only on a dot. B point is a dot point.
Okay.
Only it is a dot. It have no
Okay, sir.
area, not 1 centimeter up and not 1 centimeter down. It is only
Okay.
dot.
Okay,
Dotted.
sir.
You have to
And
find most painful area.
okay, so now when you are needling it, that means just to push in the pin and leave it.
Now I show you how to insert a needle.
It's okay.
Okay. Then you have to go insert for needle like this.
Okay.
Anterior to posterior. This is A point needle. This is B point needle. Parallel to A point. So this needle is bent. So it creates problems. 1 minute.
Please, Dr. Christiana, you are disturbing.
Yes.
Please, can I make a suggestion, please? The thing is that each time anyone is making any question or responding to Prof,
Dr. Anita, please mute
interruption.
to
So I
have.
don't know if it can only be audio without any interruption in the video display. Please.
Dr. Christina, what you want to say? Please repeat.
Each time there's a response or anybody's asking questions, there's always interruption in your video display. So we don't seem to get some of the things. And by the time it comes back, you are done with that section. So I don't know if there's a way we do it. Let it be only audio. You are hearing us asking the question. There will be no interruption in your display.
Okay. So, Dr. Anita, please mute everyone.
Okay, Prof.
Because when anyone is asking question, then screen is hidden, and some people are not want watch clearly the demonstrations. If anyone have any question, then write in chat box. I will answer to everyone. Because I am sitting only for you, and I want to teach you good and better. Okay. Then I told you the insertion of needle.
Prof, please unmute yourself, sir.
Okay.
Thank you, sir.
Then should I remove these needles? Now you see, this is the area I show you like this. When you are going for 45-degree from this line, from above the air core.
Sir, the image is
Then
not visible. It's moved away. The doll is not visible, sir.
1 minute.
Okay, sir.
Now
It's better, sir. It's okay. Yes, sir. It's okay.
okay. Then you see, when we put it like this, then you find 45-degree.
Sir, please, like you adjust it a bit again. It's a bit away now. Okay.
Yeah.
Okay.
Okay. I am putting from this end. And I mark a 45-degree. Then it is 45-degree. And when I make like this, where this line touching this line, hairline. 1 minute, 1 minute. I am doing this line. So you all are visible. When you put a 45-degree line, from here, then here is the point C. Then C is C is 1 centimeter below the hairline, like this, and 1 centimeter above the hairline. Below it is for fingers and wrist pain. The hairline point is on the hairline where it connected. It is elbow, and the end point of C point is shoulder blade. Okay. Then the indications of C point: pain and all neurological problems between the shoulder and the wrist. When you are going to treat shoulder, then you have to put needle here, 1 centimeter above, on painful point. It is visible. Then
It's visible, sir.
When you are treating elbow, then on hairline. Towards shoulder. And when you are treating for lower limb, when you are treating lower arm and fingers, then you should put needles like this. Now, if you have any question about C point, then you can ask. Dr. Anita, please unmute everyone so they can ask their question.
Okay, sir.
Now it is clear to everyone. C point.
You can unmute yourselves now and ask your questions.
Sir, please, can you explain again?
Yes, sir.
Prof. Hello, Prof. Hello, sir.
Mute me. Hello. Yes.
Okay. So they need a repeat. They want you to repeat it, sir.
Yeah. See, this is mid-sagittal line. From here, above the eyebrow and mid-sagittal line, then go for 45-degree on corner of the head. It is directly above the eyebrow corner on second demarcation. Then when you reach at hairline, then there is a point C. C point is 1 centimeter below the hairline and 1 centimeter above the hairline. Coach, I see it is not clear to everyone. So what I do? This is now it is clear.
No, sir.
The
Okay,
C point.
it's clear. It's clear.
Okay. So C point, when you want to treat shoulder, then you have to put needle on shoulder area. Shoulder start from 1 centimeter above the hairline and put needle like this. You can put needle like this also, no problem. Okay. Then for upper arm, you can put needle just above the hairline. And if you put needle from starting from hairline and you go through fully inserted needles like this in this direction, then it treat shoulder and upper arm. Okay. And when you go from above this line from here, then you treat this finger and wrist pain. Then you go for 1 centimeter down the hairline, before hairline. If you have elbow pain, tennis elbow and all, then you put needle on hairline like this. It is visible to all or not?
It's visible, sir.
It's
Ja.
okay, sir.
Okay. Now you are understand with point C?
Yes, sir, but I have a question.
Yes, sir.
Yeah, ask.
Thank you, sir. So apart from using the 45 degrees measurement,
Yes.
what other approach can we adopt? Knowing if we can know the centimeters between point B and C, sir.
No, there is no centimeters between V and C because there is different type of head. If you want to use, then you can measure. Now, if I tell you according to this dummy, then it is 6.5 centimeters.
6.5. Okay, sir. Thank you, sir.
Okay.
Okay, sir. Thank you, sir.
And if you go like this, you see in this eyebrow, then you go 4.5 to 5 centimeter above hairline, directly above the hairline. Okay. Shall we go for next point?
Yes, Prof.
Hello, sir.
Yes.
My more clarification here on the midpoint of C.
It is used for
you
tennis elbow
for
and
tennis
elbow
elbow
pain.
and shoulder, tennis elbow and shoulder pain, right?
Yeah. For shoulder pain, you put needle 1 centimeter above the hairline
Yes, I got that one, sir.
or 0.5
I got
centimeter.
that one, but I got that one. But when you said at the middle of that hairline, one will just needle deep for shoulder and
Yes.
tennis elbow. That is where I
Yes.
want clarification. Okay, thank you, sir.
If you want to treat the fully upper hand above the elbow, upper arm, then shoulder, then you put one needle from hairline and go straight 1 centimeter behind the hairline. If you want to treat only shoulder, then you target only the area of shoulder area, that is 1 centimeter above the hairline.
Yes, sir.
Okay.
Thank you, sir.
Prof, I have a question here. Sorry.
Yes.
Hello. Prof, my question is, for example, you want to treat the whole condition at the upper GRO. So, can I use only one tune needle to cover the whole 2 centimeter below
Yes.
and above the hairline?
Yes, you can use.
Okay, thank you. Okay, thank you.
No problem.
It's
But
all right.
see, here is a vein. Here is a vein. So avoid that vein to puncture. It is visible. Okay.
Yes, sir.
But Prof,
Yeah.
Please,
sir,
sir,
for
come again.
Parkinson, how can you address it? Parkinson.
I repeat it again.
Yes, Prof. They want you to repeat. I think is the aspect of there's a vein within that region, so you should avoid puncturing the vein. Be careful not to puncture the vein. That is
Okay.
what is
We have
emphasizing.
to careful a hair vein. So when you are treating, then you put needle below the vein or avoid the vein to puncture. And if it is punctured by you, then when you remove the needle, then press the area to stop bleeding. Otherwise, it may be cause a hematoma that remove in 2-3 days automatically. But when you see a patient have a hematoma in this area and internal bleeding, then there is swelling. So he may be not happy, but after 2 or 3 days, he is much happy because he got much results, much results, because it stimulate more areas. Okay. It depend on a different type of body. Now it is clear.
Yes, sir.
Yes, Prof.
Okay. Then we go for next point. Which is the next point of C? There is D point. Okay. Then I told you always, where is D point? When this line and this line. This is D point. When it meet with this line, then only the hairline on the hairline. This is D point. Okay. And then another point about it, I always tell you, the G point. When you match the eyebrow line from here and you go for top of ear, then this is the G point. Green is G and this is D. It is clear?
Prof, is clear.
Please, can you repeat it again, sir?
When you go from eye canthus from like this, and you go on ear of top of ear here, where ears skin meet with head skin. Okay, junction of the meeting of the skin, and your specs handle you put, then on this line, this is the point D. Okay. And when you meet the same area from starting from ear and you go for eyebrow, end of eyebrow, then this area is G point. This G point is used for chronic knee pain. Oh, sorry, for acute knee pain. This area is used for acute knee pain. This is D point. Then another D point is like is very near to ear. One minute. Another D1 to D6 is here. This is D1 to D6 for all type of lumbar pain. It is D1 and below the D6. It is clear to everyone. D point is clear to everyone.
Yes, sir.
Yes, sir.
Yes, sir. It's clear.
Okay.
D
Yes,
go
sir.
to
It's
G.
clear.
Then we have the D1 and this D2. This
D and D1 to D6. Okay. Then how to needle these both 2 points? And first of all, who have remember the indications of D point? You know, D point is for lower limb, and D1 to D6 is for lumbar and sacral area. Okay. L1 to S5. D1 to D6. The problems related to D1, L1 to sacral 5 nerve. And D is used for lower limb. Then how we have to needle? If you have back problems, then you put needle like this. You see, anterior to posterior from hairline. It is clear? In
yes, sir. Sorry, sir. Hello, sir.
yeah.
Yeah, sorry. Are we going to needle the point or we are going to measure some centimeter? As I'm saying that you needle for the new acute new point now.
Lower limb problems. If you have back pain problems and calf muscle pain, hamstring muscle stiffness, sacral hairline on D point. And now
Okay, sir. Thank you, sir.
you have to put needle. Suppose that one person have L4-5 is compression and there is back pain. Then you have to put D point like this and starting needle from here and go upward like this. You see?
Hello, Prof. Sorry, I have a question on this
Yes.
particular point. So, how depth of the needle?
Subcontinuous, parallel to skin.
Okay.
You can use half tune needle or you can use 1 tune needle. If you are using half tune needle, it is sufficient. Okay.
Okay. So, what I
If
mean,
there is,
what I mean, the depth of the needle, should it be 1 fem, 2 fem, or up to 5 fem?
by fen, I read it always in centimeters.
Okay.
Or in tune. Fen,
Okay.
I am not understand with fen.
Okay, I understand. Like 0.5 centimeter. 0.
Yeah, 0.5 centimeter
Yes,
or 1 centimeter. You use needles 0.5, not 0.5 centimeter. It is 1 centimeter needle.
Yeah.
And 25 needle. 1 tune is 25 mm and half tune 13 mm.
Yes, sir.
13 into 25 and 25 into 25. If you want to cover all the areas from sacral to L1, then you put needle from bottom and go through like this. Very near to ear. Not with the hairline, without hairline. Very near to ear. Like this. You have to put needles. Are you understand?
Prof,
Sir,
just a needle,
sir,
Prof.
is it going to be only one needle?
Yeah, you can only put one needle for all sacral and coccyx pain.
Okay,
If
thank
you want
sir.
to put 2 needles, then there is no problem. If your patient is not satisfied with you, only with 1 needle, then you put more needles.
But like you said, the lumbar 3 to 5.
Yes.
It's when we use the one by
Then
the contour of the eyes, right?
yes. Then you put needle from little bit up from this point and go up. No problem. You find painful point here. Always there is a painful point.
Okay,
How
sir.
many minutes, Prof? How many minutes, sir?
For minimum 20 minutes.
Sure.
Maximum,
Sure. Thank
it
you,
is
sir.
3 days. If patient is in your observation, then you can put needles for 1 hour or 2 hours. Okay.
Hello, Prof.
Yes.
I don't understand the 1 hour or 2 hours. Who is taking? Is it elderly person or young person?
If the patient is in your supervision and you put needles, then you can put needles as long as 2 hours, 3 hours, 4 hours. If the patient in a hurry, then you can remove the needles after 20 minutes.
Okay, sir.
Okay. Because the patient are so much busy. I am not now about Nigerian people, but in Indian people always are very busy. They have no work, but they are busy.
Hello,
I have
Prof.
to go my home.
Sorry.
I have to go my home and take tea. So I am want to go earlier.
Hello.
So remove needle after 20 minutes.
Yeah, Prof.
If he
Sorry,
say,
I can feel some pulse at the G point. Does it not mean it does not mean anything? I'm just putting my hand on the G points you just taught us now, and there's a pulse over there. Hope it does not mean anything, sir.
no, G point only I locate now, but I tell you about G point later on. Because before G there is F and E, 2 points are there still waiting. After that we go for G point. Now we are talking about D point, D1 to D6. Then D1 to D6 is a lumbar and sacral area, and D point is used for all type of lower limb problems.
And another question, sir, here. Is it going to be just one side or both sides?
It depends on your diagnosis.
Okay,
Which
sir.
side
Thank
is
you, sir.
more tender?
Okay, sir.
When you do HIGO LI4 diagnose, then which side is more painful? On that side you have to put needles. You are doing elbow diagnose. Now listen me. You are doing elbow diagnose. Okay.
Yes,
your
sir.
right arm is very painful. Okay.
Yes,
the
sir.
tender point on LI4, there is right arm. Then you go for on right elbow for diagnose. Cervical diagnose, then lumbar diagnose, then thoracic diagnose, then on above the elbow there is cerebellum, and basal ganglia. 3 points.
Yes, sir.
When you go for cervical and the point of right hand point is very tenderful point, then you put needle on right A point for cervical diagnose.
Okay, sir.
If you find the point is very tenderful in
Tender.
cervical
Yes, sir.
point is very tenderful, then put needle on point A on same side.
Okay,
That
sir.
side is more tender. Okay.
Yes,
Then
sir.
for lumbar area, you go for this area, lumbar area. D1 to D6 for lumbar area.
Thank you, sir.
Always put needles like these and subcontinuous like this.
But there will be no stimulation,
Okay.
sir. No stimulation, right?
No need of any stimulation.
Okay, sir.
Only find painful point and put needles.
Okay, sir. Thank you,
Okay.
sir.
Now
Yes, sir.
D
Thank you,
point
sir.
is clear to all.
Yes, sir. Thank you, sir. Prof.
This D
Yes,
point is
sir.
clear to everyone.
Yes, sir. It is clear, sir.
Now A, B, C, and D, all 4 point clear to everyone, or any doubt? Listen, if you have any problem, there is you have a patient and the patient have wrist pain, then you put C point, but pain is not going. Then you use point B and A. Then you use for wrist pain and point A. Then you put needle on A point on very bottom area of C point, of A point where A point is starting. Okay. Because C7 and C8 nerve root is responsible for finger movements. So you have to put needle on the lower area. When there is a shoulder pain, then you put first of all point C, then point B, then point A. Okay. Then there is lumbar pain. Then first of all you put point D and D1. D and D1 is most important point. Now we are going for E point. Okay. D and D1 is all type of lower limb problems. I told you earlier, all type of gynec problems, all type of male and female infertility problems, impotence problem, urine bladder problems, all type of lower limb problems, you use D and D1. And when you are using for front side problems, reproductive organs problem and all, then you have to put needle from back to anterior side like this. Okay. From back to front like this. It is clear?
For the lower limbs?
Yeah, for reproductive organs and lower limb.
Not clear, sir. Can you repeat it, please, sir? Can you repeat it, sir?
When you are treating the lower body problems, urine bladder problems, and reproductive problems, and uterus problems, and gynec problems, then you have to put needle on D point from posterior to anterior. You see now I put 2 needles posterior to anterior, like this way. And when you are using, when you are treating back pain and all, then you have to put needles from front to back, like this. Okay? It is visible or not?
It's visible, sir.
I didn't get it
Okay.
right, sir.
Now you got it? Everyone
Please,
got it or
kindly
not?
repeat it. Kindly repeat, sir.
Yes,
Thank you.
Prof. What I understand,
See,
for
when
back
you
pain,
are
the
treating,
method is
when you
different
are
from the lower
treating,
limb.
1 minute, 1 minute. I request you all, first of all, listen me. Then you want to speak. Okay? First of all, when you are treating back pain and sacral pain, okay, hamstring pain, calf muscle pain, then you have to foot pain, then you have to put needle from front to back, like this, front to back on hairline. Okay, like this. But when you are treating lower limb problems like gynec problems, infertility problems, then male impotence problem, then urine bladder problems, okay, then you have to put needle from back to anterior. Now you are understand?
Yes, sir. Yes, sir. Thank you,
Yes,
sir.
sir.
Yes, sir.
Yes, sir.
Okay. Now we are going for next point.
That's
That
the D
is,
point, sir, right?
yeah, it is D point. Now we are going for E point. E point is just above the eyebrow and 1 centimeter lateral from mid sagittal line and go above the eyebrow like this on superciliary ridge. This is visible to everyone.
Yes. Yes, yes.
Yes, sir.
It is 2 centimeter line and 1 centimeter from mid sagittal line to lateral. Okay, it is clear. Now for indications for E point, all type of chest problem, all type of organs those are in between the thoracic area, and all type of upper back pain, the pain between the both shoulder, the pain beneath the shoulder scapular region. Okay, then asthmatic problem, heart problem, spleen problem, then you have to use point E. This point is E. Black
Prof,
line is
you
E
didn't write
point.
the E on it, Prof. Help us to write the E. Thank you, sir.
Yeah, E. E1 to 12. This is E1. It is E12. Okay. Thoracic 1 to 12. Then You have a patient and that have a shoulder pain. Many time of you use point A, B, C, but pain is still going on. Then you have to use E1 side needle, and like this, you have to put needle like this. Okay. Then between the shoulder pain, both shoulder pain, there is between the both shoulder and on the spinal area, there is pain. Then you have to put needle from on second points like this. After that, you have to put when you have a problems related to heart. Okay, then you have to put needle from above 1 centimeter like this. Then when you have a asthmatic problems, then you have to put needles like this, because diaphragm is on C12 T8. Diaphragm point is T8 like this. You can put needles like this.
That's
You can put needles
perfect.
like this also. There is no problem. If you want to put like this, then there are also no problem. All needles you can put like this. No problem. Like this. If you have a breathing problem and diaphragm related problem, then you put needles like this. Okay. Like this. E point. First needle for T1, then second for T2, T3, T4, T5, T6. Then between there are 2 centimeter line, then 1 centimeter is for 6 thoracic vertebra, another 1 centimeter for next 6th vertebra. Then diaphragm is on 8th thoracic vertebra. When there is a difficult in breathing problem, inhale and exhale, then you have to put needles on T8, T9, T10, T12. It have very good results. Okay. Now, if you have any other question,
Please, I want to
Thank
know,
No,
you,
how did
doctor.
Prof.
you measure it above the eyebrow again, please?
cha, like this. I am showing on myself. When I do this, eye upward, I make my eyebrow upward. Then there is superciliary ridge. There is a crave above the eyebrow. Like this. You see?
Yes.
This is the point, location of E point. And it starts from 1 centimeter lateral to mid sagittal line. And it is 2 centimeter line above the superciliary arch on superciliary muscles. Like this. Now you are understand with this? My face is visible? Hello?
Yes, doctor.
Yes,
Thank
sir.
you.
Yes, Prof, it's
Yeah.
visible.
Okay, so here is the point E. Okay. If you have any question, then please ask and give me
Hello,
2
Prof.
to 3 minutes.
Hello, Prof.
Yes, yes.
Yes, can we use 2 or 3 or 4 needles to cover the whole areas?
Yes, yes. You can use
Okay.
2, 3 needles. You can use, no problem.
Okay.
But when you are using 2, 3 needles, in spite of that, you use only 1 needles of 1 tune. All area is covered.
Okay.
With less needles, you have more results. Any other question? Dr. Anita.
Yes, good evening, Prof. Please, I
Yeah.
want to ask, from the eyebrow to the E point, is there any measurement?
Yeah, from this is mid-sagittal line. Okay, then above the eyebrow, when there is a notch, when you upward your eyes, then there is a lines and upward area. Okay, it is minimum 1 centimeter up and 1 centimeter lateral to mid-sagittal line. Then go for 2 centimeter.
Okay, Prof. Thank you, sir.
Okay. And approximately it is middle way of the eye cornea. Ending point of starting point of T1 is approximately middle point of eye cornea. You always find a more painful point by palpating this area with any probe like this. You can check area like this. It is painful? No. It is painful? It is painful? Yes. Then put needle here like this. Okay.
Thank you, sir.
Any other question?
Good evening, Prof.
Yeah, good evening.
Oh, please, I have a question, not on this image, but on the body generally. So if somebody is having pains on the fingers, can we massage the part that has the pain, or we should put the needle? Should we needle it?
For finger pain?
Yes.
Then I just now I told to everyone, for finger pain you have to put the basic point of C below the hairline 1 centimeter like this. Okay, then another point below the A point like this. You see, these two needles.
Okay, sir.
C is bottom point, also bottom point. Now it is clear to everyone. E point is clear to everyone.
Yes. So,
Or you
please,
have any other question?
yes, I have another question. Sorry, I came late.
Yeah.
What about for back pain? Can we needle any other parts for back pain?
For back pain, we are using this area, D1. And later on, I will tell you about the point H and I, then extra lumbar, then extra foot, then extra gastrocnemius. There are all the points. After
So,
that,
for lumbar pain, you use the extra lumbar area?
yes, this is lumbar area. Near the ear, this is lumbar area. You have to put like this.
Okay.
Okay. You have to put needles like this. You see?
Yes,
like
Prof.
this. Yes. You can put needle or you can put one needle or you can put 5 needles. No problem.
So how
If
long
you
do we
want to
leave the
save your
needle?
money, if you want to save your money and build more confidence on you about your patients, then you put minimum needles. When you have to spend your money, then you put more needles.
Okay, Prof. Prof, please,
If
for
you
the
are a good
lumbar area.
physician, if you are a good acupuncturist, then you use few needles and give more results.
Okay, Prof. So does the rule of leaving how long will we leave the needle for lumbar area? How long should we needle for before we remove the needle?
These all needles are for lumbar area.
How long are we to leave it there?
Oh, for 1 hour, minimum 20 minutes. Then for 1 hour, if the patient is free and he was staying with you, then you can put it for 5 hours, 6 hours, 7 hours, 10 hours, no problem.
So
But
the
the
person will
patient
take
is want to go home, then remove needles after 20 minutes or 45 minutes or 1 hours. It is on you.
Okay.
The needles stay more time, then there is more results.
Okay, Prof. So, Prof, my last question. So, if we needle the lumbar area, can we tell the person wants to go back home after 45 minutes? We'll remove it. Can we not tell the person to come back maybe after 2 days and we do it for 5 sections?
Jaya, after 2 days. Okay. It depends on the symptoms. Some I have treated more patients with 2 or 3 sittings. But some patients take 15 sittings, 30 sittings. They have more problems, they take much time. But those have very less time of disease and the disease is not chronic, then it will take minimum time. If it is acute pain, then it is take less time. It is chronic, it is take some time.
Okay. So, doctor, does it mean that if the patient is coming every 2 days, we don't have maximum time until the pain goes?
Yes.
Okay.
2 days gap or 3 days gap, no problem. If the patient is coming every day, then there is no problem. There are 9 types of scalp acupuncture and he is also happy and you also happy. You learn all 9 types of scalp acupuncture. Then call her every day and put on needles on every day on a new area.
Okay. Okay.
Every area is giving good results.
Okay.
First day you do YNSA, then next day you do juice scalp acupuncture. Then on third day, you do juice scalp acupuncture. Then you do with the Feng scalp acupuncture. Then you go with the Tang scalp acupuncture. Then you go with the Professor Tung scalp acupuncture. Then you go with Bangwa scalp acupuncture. There is no problem.
Okay,
If
doctor.
your patient want to come every day, then say, okay, you come every day, no problem.
But Prof, you keep on needling the same place?
No,
When-
after, if you are calling the patient after 2 days and you are now only one type of scalp acupuncture, then you have to put needle on the same place. If you now 3 or 4 type of scalp acupuncture, then there are more time to change needle locations.
Okay, Prof. Thank you.
Okay. Yeah.
Thank you, sir. Good evening, sir.
Good evening.
Yeah, thank you very much. God bless you, sir. Where can we add to mouth area in the case of loss of voice as a result of stroke?
Brother, sorry. We are now doing basic points. If you have a patient and you want to know about any protocols, then you call me personally, because now I am telling you about the basic points. Then we go for next point. Sensory point. When we are doing sensory points, then I clear your question, because it is a sensory moment. Speech is a sensory moment. You know.
Yes, sir. Yes, I know. I do.
Okay. Then I will tell you, no problem. I tell you everything.
Okay, sir.
What you learn, it goes now. Because I am only teaching you, and what you are learning, you know and God knows what you have to learn. I have a responsibility to teach you all because of humanity and all things. So I am teaching you all. There is no problem. But how much you are gaining from me, that is your way. If you want me any question, ask me personally. Always, no problem. Anytime you can call me, no problem.
Okay, sir.
Okay. Now we have, I have no problem. Before this time, I tell how to put needles on scalp, on my own scalp, on my own scalp. You see in my Telegram channel pictures.